So the LEAP study that you mentioned, Ted, yes, it was a phase 4 study of trifarotene to assess its efficacy in acne-induced post-inflammatory hyperpigmentation. And we have data from in terms of retinoids and hyperpigmentation. We have data dating back all the way to the early to mid 90s with tretinoin, demonstrating that tretinoin could improve acne-induced hyperpigmentation, but it did so with a pretty high rate of irritation in those days. And since then, we've seen some small studies with tazarotene, some observations of improvement with adapalene, but no formal, big, robust studies that are vehicle controlled for acne-induced hyperpigmentation until now with trifarotene. So this really builds on our overall body of data for using retinoids for hyperpigmentation. So this study was a 6-month study or 24-week study, and patients were randomized to either trifarotene cream plus a skincare regimen that included a gentle cleanser and a moisturizer containing sunscreen, versus the group that got vehicle as well as a moisturizer with containing sunscreen and a gentle cleanser. And it turns out over the course of the 24 weeks, both groups did show reductions in hyperpigmentation, but there was a significantly greater reduction in at least the secondary endpoint called PAHPI score, PAHPI, which is post-acne hyperpigmentation index, which takes into account lesion number, size, and extent. And with that particular secondary endpoint, there was a significantly greater improvement at week 24. The primary endpoint actually was a more sort of general overall assessment of hyperpigmentation severity called ODS, which stands for overall disease severity. In that using that particular outcome measure at week 24 was actually a non-significant difference. But at earlier time points, there was significantly greater improvement in hyperpigmentation in the trifarotene group versus the vehicle. So I know that's a very long and somewhat complicated answer, but the bottom line is that the primary efficacy endpoint chosen in this study was a more of a general measure of hyperpigmentation called ODS. And at that 6-month time point of week 24, which was the primary endpoint, it was a non-significant difference. But using the secondary endpoint of PAHPI, a validated tool to measure acne-induced hyperpigmentation severity, there was significantly greater improvement in trifarotene. So your thoughts, Ted?
Yeah, I think it's such an interesting study. And, I think the ODS was a relatively new scale when this study was started. And so I think there was a lot of discussion, and I'm sure you were involved in that, Dr. Alexis, in regards to which is our primary endpoint. And it turned out that the ODS probably wasn't the right scale necessarily to use as primary, just because with good sun protection, we saw that the vehicle, those on the vehicle plus sun protection, I should say, caught up eventually. Although we saw a much quicker reduction in the overall kind of gestalt improvement with trifarotene. In my view, looking at this data, I really would focus more on the secondary endpoint, the PAHPI score, because it does, as you mentioned, include the size of the pigmentation spots, the number, and the intensity, which I think patients actually focus on much more than the overall disease severity, because if they have even one spot that's still dark, it drives them crazy. And we see that as derms, we see that all the time. And so by showing you a reduction in those 3 metrics grouped over time, I mean, it's significant in terms of the improvement as compared to vehicle. As early as week 20, we get statistical significance spread more at week 24. And remember, this isn't just against a vehicle, it's against sunscreen as well. And we know that good use of sunscreen will reduce pigmentation. it's always difficult in my view to get statistical significance against a vehicle plus a sunscreen when you're going after pigmentation. And so this is some really good data to show kind of what we said before, which is what we saw with the gene expression, the in vitro data is pulling through now to in vivo human data with this acne induced pigmentation.